So quick run through of what we're doing here. We are doing a immediate implant placement for a lower right first molar. As you can see on the CBCT, we have plenty of bone. The tooth has just been freshly extracted. We've managed to maintain the interradicular bone, and that's where we're going to place our implant. So plan it right in the center, buccolingually as well as mesiodistally, right into the interradicular bone on the mesiodistal um, section of the CBCT. Of course, we're doing a 5.5 by 10 millimeter implant. Next step is the calibration. So we'll mark our landmarks, 3 points as far away antero-posteriorly as possible to give us some more accurate reading. Then of course you take once you've calibrated the calibrating tool, take it, hold the point and go around it in concentric circles to make sure you record enough points to give you an accurate reading when you're doing the drilling protocol. Then of course you start the drilling. So you make your entry point, go through and try and go all the way up to depth while maintaining the angle at the center of the bullseye. It's very important to look at both the buccolingual view as well as the mesiodistal one, both of which are on either side of the bullseye, because that'll tell you precisely where your drill is, what the angulation is, and what depth you need to go at, and where you need to sort of angle it to make sure that you're within that box. The box remains more important than anything else. You have to stay within that box to accurately place the implant. As long as you're within that box, your placement should be fine. And then of course you have to calibrate each drill individually before, and then of course check on one of the neighboring teeth to make sure that it is accurate, and then again carry on with your drilling protocol. So here you're going to drill all the way up to 4.7, and as you can see, you can go in with a different entry point and change the angle while you're doing the drilling, because it's almost impossible to keep going straight through at the precise bullseye point with the correct angulation. So you can change it once you've done the initial drill and the entry point's correct. And then of course you'll calibrate and then go again with the next drill. So as you can see, we're not too far away at the moment. The entry point, even though it looks really far away on the bullseye, it's only about 1 millimeter away from where our bullseye is precisely, and when you're within that range, you should be fine with your implant placement. So in this case, it's because all of the drills are of the same length, it isn't mandatory to actually recalibrate every single one of them. However, it is recommended that you do that. So certain drills here I have recalibrated, while others I haven't. But you should always check the accuracy before you start drilling, even if you haven't calibrated the drill, and especially if you haven't calibrated the drill. Even if you have, you should always check accuracy. Here again, you have to go all the way down to length. It'll give you an exact marker. You can go a little bit beyond. You don't want to go too far, obviously, because you want to remain 2 millimeters away from the inferior alveolar nerve at all times. And of course, the last thing that you're going to do is place the implant. So as you can see, we've already calibrated the drill along with the implant. And then now we're going to be doing our implant placement. And you can actually follow the bullseye and the length. So that'll give you precisely where your implant needs to go. And the angulation obviously can change once you've placed it inside. You can tilt the handpiece and correct the angulation. And there you go, that's where we've placed our implant. And of course, the final thing, of course, is to take a post-op CBCT and check precisely where we've placed it. So in this case, we've actually got a very good result. We've only got an angulation change of 3.3 degrees, and our apex in a vertical dimension has only moved by 0.55 millimeters. Our entry point is only 1.82 millimeters away from the absolute bullseye. So we're in a very, very good spot.